Okay, guys, I'm going to attempt this again. This is a lot of information I want to try to get to you. Okay, this is about bipolar disorder and drugs in the brain. I'm not going to be able to get into all of it because there's way too much. But, excuse me. The National Institute on Mental Health, the NIMH, estimates that 2.6% of the American adult population suffers from bipolar disorder. And with bipolar disorder, we have manic and depressive episodes. The manic is when your brain's racing and when you have all this energy and too much energy. Well, then the depressed is when you're way down here and you need energy, don't have enough. So alcohol and drugs can seem very, very enticing to those who are not, they don't know what's wrong, they have not been diagnosed, they're not on medication. So they would abuse alcohol or some sort of sedative like, Xanax or something like that to slow their brain down when they are manic, when they want to relax. Okay, and when they're down and so depressed they can't get back up, then they're more likely to abuse speed, methamphetamine, cocaine, because this brings them back up. And it makes the manic episode even like higher. The problem with that is the higher you go, the more when you crash, the people who have bipolar disorder will be more likely to not be able to function. They'll be more likely to not be able to get back up. They'll have more suicide attempts or suicidal thoughts. It just, it's horrible how it affects people with bipolar disorder, because the more up and the manic you are and the longer you stay that way, the harder it is to get back up. When you crash, you feel like it's a horrific feeling. The the regions of the brain, there are several regions of the brain. Naturally occurring chemicals are involved in mood regulation, which we know is dopamine and serotonin. Those are do help to improve moods. The increased rates of pleasure, and are involved in impulse control abilities, memory formation, learning, and motivation. The prefrontal cortex is the part of the brain that helps with information processing, decision making, and reasoning, while the hippocampus and the chemical cortisol are involved in the stress response. High levels of cortisol are generally connected to elevated stress. Okay, brain imaging has shown that dysfunctions in these parts of the brain and in levels of brain chemicals may be related to disorders such as bipolar disorder. The NIMH publishes information on brain imaging that show possible abnormalities in the prefrontal cortex and other regions and chemicals in the brain related to emotional stimuli and impulsivity. In people diagnosed with bipolar disorder, major depression and anxiety are often linked to low levels of serotonin and dopamine and high levels of cortisol as well. In addition to being related to brain functioning and structure, bipolar also has genetic connections, which means if you have a parent, a sibling, that have bipolar disorder, you are twice as likely to have it than the normal. And then, okay, so you put that on top of environment, things that happen, abuse, post-traumatic stress, violence, drug addiction, being around parents who are drug addicts, then it raises it even more. And if you have a parent who is addicted to drugs or alcohol, you are 50% more likely to become addicted to yourself if you try these things. 50%. That is one in, like, say I have two kids, one of them is probably going to be addicted to if they try alcohol. Because alcoholism, my dad was an alcoholic, my brother was an alcoholic, now my son has alcohol issues, and I did too. So that's overwhelming. Like, that says to me, we didn't all have bipolar disorder, but we all had alcohol addiction problems. There is no, I mean, in my mind, there's no doubt that that's hereditary. That runs in your genes. There's no doubt. I mean, it doesn't mean for sure you're going to get it, but it means it's pretty likely that it's a big chance that you're going to have problems. And with my brother, he started at such a young age. I don't know which came first. But with me, I know which came first. I know that I didn't do drugs or alcohol, until I started probably 1920, when I started feeling my moods change. And I think the same way was with my dad. My dad was definitely bipolar, and he had schizoaffective, which means he had a lot of schizophrenic symptoms as well, characteristics. Like, he would, hear and see things, but that would be like the psychotic part of the bipolar, or delusions of grandeur, or hallucinations, visual or hearing. But the thing is, since this is what's mind blowing. People suffering from bipolar disorder often turn to drugs or alcohol. The journal Current Psychiatry publishes that as many as 60% of those diagnosed with bipolar 1, which is what I have, which means you've had full-blown manic episodes with major depressive too followed, or in there. You could have had mixed episodes. You've also may have had psychotic features, which means hallucinations, delusions, these kind of things. And the thing of it is, when the two disorders, when addiction and a mental disorder occur in the same person at the same time, it's called co-occurring disorders. The difficulties of co-occurring addiction and bipolar disorder include the symptoms come on earlier, at an earlier age. There's a more significant clinical presentation, poor outcomes, more suicidal attempts, increased rate of anxiety disorders, higher number of depressive episodes, more frequent hospitalizations and rates of accidents, increased rapid cycling, which rapid cycling means that you don't, like a manic episode could last from anywhere from a week to a month longer, and then you could go for a long period of time and be okay and not have one. Well, rapid cycling just means more than 4 in a year. You have more than 4 episodes in a year. I believe that's what it is. And I could be wrong. Check me on that, but I'm pretty sure it's very it just, you don't have much in between. You just are up and down and up and down. Because most of the time, people they have their manic, and their manic episode. It lasts, however long it lasts. Then, it could be followed by the depressive, and then they could go for months, years, even, in a stable mood. But people who recycle, rapid cycle, don't. They don't have a lot of in between. And also lower compliance to treatment. means they don't stay on their meds if they have addiction problems. So, as you can see, both can interfere with your daily ability to perform tasks and function normally in society. So, homelessness, financial strife, unemployment, interpersonal relationship difficulties, accidents and injuries, troubles with the law and legal entanglements, and physical decline are all possible side effects of both bipolar and disorder and addiction. Doing drugs before the brain is fully developed in early adulthood can also have lasting consequences, leading to an increased rate of mental illness. That means that the actual addiction could cause the mental illness if you started at such a young age. Drug abuse can possibly cause psychotic side effects, which means, it can look like a mental illness. So drugs can leave long-term negative effects on the brain, body, and behaviors, the consequences of which are exacerbated by the simultaneous presence of bipolar disorder. So drug addiction in itself is a disease. People's brains get rewired once, when you try the drug, usually, it's because you wanted to. You were curious or whatever. And then it made you feel a little bit better. So then it made you feel good. So you try again. What you don't realize is the chemistry in your brain is changing every time. And once you get dependent on that drug, your brain cannot function the same without it. It cannot have the dopamine or the serotonin. It's depleted unless you have that drug. And so your brain is automatically going to crave that drug. Whether you want it to or not, whether it's having bad side effects on your body, your health, at that point, it's not even in your control. Yes, a person can overcome this. But if you have both, you're going to have them both treated or it's not going to ever work. You got to have the alcohol and the drug addiction and the bipolar, dual diagnosis. Try to find some place that does that. I don't know. I wasn't, at the time that I was diagnosed, I was not addicted to anything at that point. I had stopped using alcohol, years before that, because like I said, I almost lost my son. I felt like I was going to, or whatever. It was having such a negative effect on my life that I did other things. But I have had other struggles, which I'm not going to go into right now. But you have to, you can't, if someone is abusing alcohol, it's not going to help to put them on bipolar medication. Because it's only going to, there's going to be, the way it interacts with these medications is never usually good. Well, it's not good. You can't be on both. So dual diagnosis is really, it's important because people can hide their alcohol use. And they should be tested, they really should. People who have mental disorders should be tested for drugs and alcohol. And not just when they first start. Because my brother hid his, from his psychiatrist for years. So, the thing of it is, it was making his health just deteriorate more and more. Don't look at the person like they're a horrible person. They're a drug addict. They have a disease. They're going to just suffer with this disease for the rest of their life. Yes, they can overcome it, but it's going to be a daily struggle. And they're going to need lots of support, lots of help, lots of encouragement. They're going to need professional help, rehab, and if they have mental,